Johnson&Johnson is a broadly based healthcare company that does work in consumer products, in medical devices and diagnostics, as well as in pharmaceuticals. And we are probably the largest healthcare company in the world. We are a very purpose-driven organization, and our goal is to combine heart, science, and ingenuity to profoundly change the trajectory of health for humanity. And so it's an organization that's 132 years old. We have 130,000 employees all over the world, and our focus is on healthcare and improving the world. Science is actually at the core of everything that is important for progress for society. Science and technology, for us at Johnson&Johnson, science and technology is in the DNA of our company. But also we believe in supporting science all over the world because we believe a great idea can come from anywhere, which is why we also are the founding sponsor of the next Einstein Forum. Because that is the inspiration that the next Einstein for this world will come from Africa. So supporting Africa's science and encouraging the young millennial population, but as well as everybody in Africa, about science that is taking place in Africa and by African scientists is going to be a really important part for us. Johnson&Johnson has a very long legacy in Africa. So we've been there for more than 86 years. And so we have many of our businesses there, including our consumer business, which is located in South Africa, in Cape Town, where we have a manufacturing plant for consumer products. And we also have a pharmaceutical and medical devices businesses across Africa. And then we've had for a long time a legacy in global community impact or social responsibility, working with local NGOs on a variety of different initiatives all across the continent. And then finally, we also have what we called our Global Public Health Group, the headquarters of which is in South Africa, but we have offices in Ghana and Kenya. And the Global Public Health Organization really aims to is focused on 3 different areas, which is tuberculosis, HIV, mental health, but also in many other platforms, including, for example, Ebola and global health security. Because when there was a big outbreak in West Africa in Ebola, one of the big things that we did was we brought forward and accelerated a vaccine for use in Africa for the Ebola outbreak. We manufactured 2 million doses of vaccine for Ebola, which is ready for use should there be an outbreak again. And when there was a recent outbreak in the DRC, we were standing by ready to deploy the vaccine. But the good news is that it seems to be contained so far now. And the next Einstein Forum in Kigali in Africa, we launched what we call the Africa Storytelling Challenge, because we know that there are more than 25,000 scientists of African descent or in Africa, and unfortunately most of the time the rest of the world doesn't know about the great science that is going on in Africa. So we launched a storytelling challenge to inspire African scientists to tell stories about the science that they're doing. And it's a contest, really, so that first of all, any story that is validated and is checked out, we will publish all of them in a digital compendium. And then we also have winners of the Africa Storytelling Challenge, and those winners will also be announced on a rolling basis. And this is a way to actually break down the stereotype of Africa as a country that is ridden with poverty, disease, and other problems. It is a positive story of Africa and the science and the entrepreneurship and the millennials who are actually taking a big role in African local-based solutions to local challenges.